We found through our data and through our turnover, through our retention, that once people understand our model, especially our doctors, for example, there's no turning back. They're like, holy cow, I didn't know there was this side of healthcare.
So what does it really take for your business to attract world-class talent today? I'm Dave Travers, president of ZipRecruiter. And on Talent All-Stars, we shine a light on the people and the day-to-day processes behind recruitment and retention at some of the world's most influential businesses. When you think about healthcare, you probably picture hospitals, clinics, or urgent care centers. But there's another side to care, one that happens right where people work and live. That's where Premise Health comes in. They're the largest direct healthcare provider in the U.S. with more than 800 wellness and care centers in 46 states, all designed to make healthcare more personable and accessible. And leading the people strategy behind that mission is Liz Reimer, the company's chief human resources officer. In this episode, Liz shares her recruitment marketing playbook, including the video campaign that's helping fill certain roles in less than 14 days. Plus, why her TA team is divided into sourcers and advisors. And the 3-word mantra she recommends you use when briefing a senior executive. So let's bring her in. Liz Reimer, welcome to Talent All-Stars.
Thank you so much. It's a pleasure to be here.
Excited to have you here and excited for a number of reasons. But before we get into all of what you're doing now, I want to start back closer to the beginning, maybe not all the way at the beginning, but at some point along the way, this being an HR people leader thing became not just the current job, but really became a path and a calling for you as your career progressed to high and mighty places. Do you remember any specific moment where that clicked for you, that this might be the thing for you?
It's interesting. I think there was 2 separate moments. I think the initial start of my career as a recruiter, it felt like an honor to be able to assist people in whether it was finding a new career, starting for the first time in a career, or enhancing in their career. And that feeling to me was just so great, right? So I said, this is really cool that I get to do this as a job, is to help people really find out who they want to be and bring them success. And then I think secondarily, as I was in recruitment and I started to, kind of have tentacles into the other areas of HR and learned about them, it was kind of the same thing. I was like, this is such an awesome thing that I get to help people have an experience at work that then helps them have this wonderful career. And there's no better place than in HR to be able to really touch any employee in the organization and help them with that. And so I think as that kind of morphed over a few years after recruiting and getting into the HR functions, I was like, this is the right place to be. For me, it was about generating a new experience for people while they came to work each and every day. And I was like, this is cool.
Yes, it is so fun to be able to impact people's lives and be able to see it as you walk into the office every day. It's like, hey, that person, that I talked to as a candidate 2 weeks ago is here as a person really contributing today. I love that. Okay, so then as you became addicted to that feeling or wanted more of it, and then at some point along the way, not just being a part of it, but being a leader, how did that come about where all of a sudden you were finding yourself leading teams? Was that something you immediately knew you wanted to do, or how did you get into the leadership side of things?
I feel like it was. I have always, for some reason in my life, even as a younger child, played a lot of sports. I was always in a leadership role in those sports. I come from a really large Italian family, so it always feels like you're on a team. Team is just what feels comfortable to me. And I think you kind of combine that with just the amount of curiosity I had as I was growing through my career. I'm like a F1 driver. Sometimes I wouldn't look back. I'm only curious about what's in front of me. And leadership was part of it. So I kind of knew from the beginning that was what I wanted to do. I really enjoyed being around people, leading teams, and seeing the effects of that.
So if you're a person who knows, like instinctively, you always knew that was part of the path and you were always looking forward and saw that, how did you manifest that? How did you make it happen and come into reality?
That's a good question. I think, as somebody gave me the opportunity, first and foremost. And so once I got the opportunity, I think it was just really important to realize really, really quickly that it wasn't necessarily, I wasn't in that leadership role just because I was liked or maybe they saw a great capability in me. I knew very early on that I needed to surround myself with people that were better than me, that had really good skill sets. And my job, as it was any other time I was a leader of a team, was to support motivate, and empower my teams to really, by providing them resources and removing obstacles, that was more of what I needed to do and how I think I made that successful. And I think realizing that right off the bat, that it wasn't just about me, it was really about the success of the team and those that I put around me. I was like, okay, this is kind of cool. Now, number one, I don't need to know everything about HR, which, by the way, haha, I don't, but I know enough, and I know that I've got the right people around me that know everything they should know. And that's how we made it work together. And I think that manifested very, very quickly as I realized that very early.
There's something so counterintuitive about the transition from individual contributor to leader, where you get to be a superstar individual contributor because you know how to do the job really well. And you know every detail of it, you know how to outwork, et cetera. But then all of a sudden becoming a leader, sitting over someone's shoulder saying, I know how to do this and I know how you should do that too, isn't necessarily, to your point, the way to motivate and learn. You talked about sports teams, you talked about family. How did you learn those skills that the thing that made you the superstar individual contributor wasn't? How did you come to that insight that wasn't the way that was going to help you motivate your team to be successful?
Honestly, I think I just realized really quickly that I could not know everything. It was virtually impossible, especially when you start running multiple functions in HR. And I was like, I'm going to die doing this job, right? And I'm not going to be able to keep teams on board because I cannot be the know-all. I won't. I'll burn. I will completely burn. So I think it was just a personal experience. I was always a part of really fast growing organizations. And so that obviously helped when you've got that growth behind you, that you had to figure out really quickly how you survive. So I was like, I've got to do something differently here. And I know it can't be all about me.
Yes. And I think there's something when you're in a position of having to trust your team, there's something very scary about that. Like now all of a sudden your destiny and how you're going to be judged is not within your 100% control. However, it's also very freeing. As you point, instead of feeling like you're burning, all of a sudden it's like, oh, I can focus on that thing that's really important rather than that thing that just happens to be urgent right now.
Absolutely. And, you said a couple things in there too. And I think one of the things that also helped me was I had to learn very quickly that there was a really big importance on managing up effectively. So, you've got to be operating things at your level really, really efficiently to be able to manage up. And if you're not managing up, you're not helping organize how you do that, what venues you should be communicating to, who you should be communicating to. Sometimes even that can be demotivating to your teams because all of the great work, all of the hard work that's going on is not being appreciated or known. So I think that was another thing that I learned really, really quickly, that I needed to get my act in order and know how to manage up to the C-suite and make sure they knew what we were doing.
I love that because they're not counting on you to sit over their shoulder. They're counting on you to go get the resources and communicate all their wins to the bosses. So that's exactly right. If that's all of a sudden you find yourself in a position where not just doing the work, but communicating upwards, if you're a first-time leader and all of a sudden that's on your plate, how do you even start getting good at that? How do you manage up effectively as a rising leader?
That is a great question. I don't know that I've perfected it, but I think, making sure you can organize your teams, your meetings, your cadence of meetings in a way that's going to allow you to continuously and effectively get the information that you need to prepare you for whatever meetings, for example, or situations that you're going to have to be in front of every week, every month, to kind of keep that communication flow moving. And it actually takes quite a bit of strategy to really think about how to do that because there's so many moving pieces, there's so many meetings going on. But to find the right way to make those communication methods move up and down consistently and getting the right information to you in a very concise and easy way, I think is key. And it's taken me many, many years to kind of perfect that. And as the organization changes, sometimes that strategy has to change, but you really have to sit down and organize the way your days, your weeks, your months, and your teams work together and communicate together.
I think that is so true. You touched on it. One of the ways the organization of managing upward comes across to a senior leader is the fact that you can boil something down to its essence. Like as a new leader, oftentimes what I see is that the impetus is to show, I know absolutely everything about this topic. And the senior leader is not looking for that. They're looking to take a very thin slice and say, oh, this person's got it. I don't have to worry about this anymore. And being able to boil it down and leave the senior leader even wanting a little more detail and knowing that detail, if asked, is the path.
So funny that you say that, Dave, because everybody knows on my team that if you're giving me information, if I'm going to present specifically to an executive, my motto is be brief, be bright, be gone. So and it tends to really, really work. So they know to kind
Yes.
of prepare me for those three kind of categories. And usually we can knock it out of the park.
That is exactly right. Very few senior leaders that I've met are bashful about wanting to know more if you didn't give enough details. But I've seen very many senior leaders say, wow, I just got a 25-minute answer to a 2.5-minute question that I was hoping to get moved beyond. I love that. Okay, so one of the things about your career and where you're at now at Premise is you're not just anywhere. You've chosen a career where you're very much in the middle of healthcare, which, is an industry into its own that has its own people issues and recruiting issues of chronic talent shortages in certain critical roles. Often things don't just feel like life and death issues. They really are, live on the line type issues. How did healthcare draw you in, and what makes healthcare different?
I fell into healthcare unexpectedly. I didn't have any desire or interest, I think, from when I started. But when I moved to Nashville, I actually moved here because I was dating my now husband. So really, he brought me to healthcare unexpectedly. And, and healthcare is, I don't know if you know, but Nashville is like a healthcare mecca. I mean, there's so much healthcare here. But then once I got into it, and I was on the commercial side and the Medicare side for a long time, and really, the two companies I worked for specifically on that side of the house were so good at helping you understand the mission. And it always felt good to me that we were doing something with a mission that was helping people versus, and no offense to people who are in oil and gas or whatever, but the mission just connected with me from that perspective. And I've chosen from that point forward, if I can stay in healthcare, that's the place I wanted to be. And I have.
It's so true. Like if you're in recruiting or in management, at an enterprise software company or at an industrial parts company or something, which are great and have great missions, but they have to reflect a lot on like, what does our mission really mean? What part of this do we want to express? Healthcare companies don't have to have that big talk with themselves to figure out why are we here. The mission is very self-evident and very meaningful. Okay, but it also comes with challenges.
Oh, goodness.
And one of those is that it's hard to find talent. What is the key? If you're a budding talent or people leader at a healthcare company and you're like, holy cow, this is really difficult and we don't have the plan or the resources as we scale, as the labor market changes, how do you approach that? How do you attract talent at scale?
Oh, that's a great question. And every healthcare organization, even though we may be in the same space, has their unique challenges. I think our biggest challenge is if I had to narrow it down versus saying this position or this position is where we have the hardest time recruiting. For us, it's healthcare is competitive space and our brand recognition. So I don't know, Dave, I have to bet that if you had not gotten me on this podcast, I'm not sure you'd ever have heard of Premise Health before. So unlike large hospital systems, Premise Health operates in kind of a niche healthcare model. So we're delivering care to employees within very specific organizations. And because we serve a more focused population, many healthcare professionals aren't kind of familiar with our name. So I think that driving brand awareness, and I don't know if this sounds like real fluffy or not, but really is so important to us from our recruitment strategy. And it's something that we've had to prioritize in our recruitment efforts. We've invested a tremendous amount of money in the right marketing, kind of recruitment marketing vendor partnerships to really help us attract, engage candidates, activate our brand because of what I just mentioned, and optimize and kind of track our results so we know where we should be putting our money, where we should be putting our jobs most effectively based on our industry. And we've also really dedicated sourcing teams. So in my TA model, I have advisors and I have sourcers. And our sourcers are just that. They are hunting, they are out selling, if you will. They're out doing all the outreach, whether it's job boards, LinkedIn, emails, text messages, all the things you normally would expect. They are participating in those creative engagement tactics through that branding relationship and that marketing relationship, whether that's connecting with both passive and active talent. talent. And that's done through technology and very personal connection. We're just getting ready to institute a new CRM, which is fantastic for us. So we are building great talent communities. We can drip campaign to them. We can contact our people that we want to come back and boomerang back. We go to conferences with ambassadors. So we bring our team members with us, especially our docs. They can tell our story. They can really kind of relay our EVP. We use a product called Culture HQ where we do live videos from our team members. So again, people can kind of really feel what it's like to work here. So where I'm going with that is it's really critical for people to understand kind of what resides inside these four walls, because we found through our data and through our turnover, through our retention, that once people understand our model, especially our doctors, for example, there's no turning back. They're like, holy cow, I didn't know there was this side of healthcare. So really for us, that strategy is about really getting our brand out there and telling our story, because we have a successful culture and we have just an awesome business model that physicians love. And typically once we get our physicians on board, they don't turn.
What's so cool about that is I think there's so many companies in healthcare and outside that have reached a similar point that it sounds like you guys have, where you're certainly big enough and growing fast enough that just networking and using referrals, is like no longer going to work for the scale at which you need to go. But you're not yet a Fortune 50 company where your name brand, everybody's heard of you, your reputation precedes you in every single case. So you have to now start telling your story for the first time. This comes naturally to the marketing department when thinking about customers, but to HR, it's not always the first thing. So if you're a leader at another company who's facing that moment and just starting now, we have a great story to tell. When you talk to one of our doctors or one of our key employees, they'll tell you that what a great place this is to work, but we haven't ever told that story in a systematic way before. How do you recommend starting the employer branding journey and spinning up that muscle at an organization?
It's a great question. I think first and foremost, you have to make sure you know what your EVP is, what your value proposition is, and that it's something that you are talking and speaking with your employees about first and foremost, because you would hate for that to be different than what you're going out and telling folks. So make sure you've got an EVP. We have one. We've got some team member experience pillars. They're based off of 5: meaningful work, engaged leadership, positive work environment, growth opportunity, and trust executive leadership. And so if you can figure out, or if you can identify what your EVP is, then figure out how to bring that to life. Work with your internal marketing team if you have one, and help tell the story of what it's like to work inside the walls of Premise Health or XYZ organization. Employee testimonies are very, very strong. You may have specific roles in your organization that require very specific specialties to come forth and talk about those jobs. Like our docs would rather talk to docs, right? And if they can hear what it's like from a doctor, then they're hooked. If you have the budget, or if you have the ability to build a business case to work with a recruitment marketing firm, specifically a recruitment marketing firm, they can change your life on this process.
That's super wise. And what I've seen, even as people get started, is the notion of establishing the value proposition. It sounds simple, but when you think about it, like, if you're a candidate, you don't want somebody to just read to you what the job description says. You want to hear, like, what do real people really think? What's it like to be in the kitchen at lunch? And what do people really say about working there? So if you haven't got that, how do you get started? And you haven't built the business case yet, how would you get started to build that value proposition?
Oh, goodness. Well, I'm trying to think about how we did it years ago, but, even if you don't have funds, if you're limited staff, get out there and do some listening tours, talk to your employees, talk to your leadership, and try to identify what it is you're hearing that retains folks, that draws folks to your organization. And then more importantly, what are your executives? Talk to them, help understand what it is that they want to deliver to the organization and to the team members, because really an employee value proposition is your commitment, right, to your team members and what they will expect if they come to work for you. So, you can start small ways like that, surveying, talking to your team members, talking to your executives, and trying to bring those themes together.
I think that is so true. And even if you just think about the 5 people in your organization that you wish you had more of, if you talk to the 5 of them about what they would say to their friend or their cousin about coming to work there, now all of a sudden you've got the raw material to start with, I think.
And then maybe you can use those people, those 5 people. We have just started doing a tremendous amount of video on LinkedIn, and we'll have the hiring managers do a live video about what it's like to work at the client in that job. And we are on average filling those jobs in less than 14 days.
Wow.
Specifically off of those videos because people are hearing from our team members.
That's awesome. Okay, so the buzzword of the day that we haven't gotten to yet is AI. I don't know if you've heard that buzzword before. Of course you have. Everyone's heard it 10 times already today. So AI is everywhere and the talk of it is everywhere. How do you, in a rapidly growing organization that needs people and has to choose where to focus your time and energy among many different things you could focus on, how do you use technology and AI and choose where and when to start applying it and where and when to say, I'm going to wait for a technology to develop a little bit more?
So my leadership team, from an HR perspective, in conjunction with our executive leadership team, we have sat down and kind of agreed to how we want to approach this. So we feel like a little bit more of a disciplined approach is more proper. And that approach for us in HR specifically has to balance the desire for an exceptional humanistic experience with efficiencies gained by AI, kind of at the core of our initial scope conversations. So we've tried, and we've been working on this for like the last 6 months, is identifying spaces and places that we think are going to bring us better efficiency. And then how can we balance that with that humanistic approach or humanistic experience? So we went through all of our different functional areas, identified maybe where we have high volume, we need to improve productivity or efficiency, narrowed it down, kind of decided on a couple places that we think would be best for us and what those tools would be. So instead of just randomly, if we just allowed the floodgates to open, we'd be trying AI out in every space and place, and I don't know how effective that would be. So we've decided to really take a disciplined kind of approach, surgical approach to it, and start there.
I think discipline is very smart because you could spend all day, every day, and so could your team, testing every tool and thinking about every thing, and you have to pick and choose where you're going to start.
And we also agreed that we would, make sure that we do a pilot plan on most all of the AI tools that we're going to use, audit, feedback mechanisms, so that we can ensure it's the right tool, and then we'll feel comfortable whether we want to launch it or not.
Love that. Okay. We always end these episodes with what we call a lightning round. So I want you, speaking of managing up, I want you to envision the scenario where the CEO of Premise walks into the elevator with you and you've got 30 or 60 seconds and the CEO says, "Hey, Liz, I was thinking so much is changing, AI and everything else about our business. How should we measure the success of the HR team over the next year or two?" What would your answer be to that?
Oh, there's so many, but I think the first one is we are heavily involved in our team member experience here. My CEO and I are hand in hand. So I think really measuring and understanding our team member experience scores for the organization, it really kind of validates the health of our org. And because we have such a huge part in making that process work and making that culture drive, I think that's just a huge one for us. And we do monitor that. I think there are 2 very simple stats or statistics or metrics, but I think also following our days to fill and our days to start is a huge one. And that's something we've invested a lot of time in. And our benchmarks are being blown out of the water for a healthcare organization. So we're doing something right. And when we hire right and when we hire people effectively, we bring revenue in the door.
You're never going to have an executive be unhappy with days to start or days to fill as a metric, because there's no executive in the world who's like, I really like my recruiting process. I just wish it took a little more time. No one's ever going to be worried about that. So that works. Okay. Same scenario, another lightning round type question. CEO walks into the elevator and says, "Liz, so much is changing about our business. What are the skills that we need more of over the next couple of years that we don't have enough of in the organization today?" How do you think about that?
I think there's one very specific skill that comes to mind, and I think it's just straight up adaptability. As the workforce evolves with rapid technology advancements, shifting employee expectations, global and economic changes that we're all experiencing, leaders and people must be agile in their strategies. They have to embrace continuous learning and really foster a culture that can quickly respond to new challenges and opportunities. Like, I think it is a hands down, like, it's part of the stool. You got to have it.
One of my favorite tricks in life is to invert things. I learned this trick from a couple other people. But, if you're thinking about something like a principle like adaptability, one way to test it is to think of the opposite. So if you had a great interview with somebody and you said at the end, hey, is there anything else you'd like me to know? And they said, yeah, just one other thing. I really just don't like change. I just like steady stableness all the time. Like immediately my the color would come out of my face. So like now I've caught onto something. Yes, adaptability. That is key. Liz Reimer, thank you so much for being on our show. It is so clear why you're a Talent All-Star. Thanks so much for joining us today.
Thank you, Dave. Appreciate it.
That's Liz Reimer, Chief Human Resources Officer at Premise Health. You'll find her LinkedIn profile in the description below. And by the way, we're an audio podcast as well. Just search Talent All-Stars in your favorite podcast app and tap follow. If you've got feedback for us or ideas for future episodes, send us a note to talentallstars@ziprecruiter.com. I'm Dave Travers. Thanks for watching Talent All-Stars. We'll see you right back here next week.